And to start us off, we have the Regional Sales Manager from Kenya Medical Supplies Authority, Mr. Daniel Dingori. He'll say something small before we welcome His Excellency the Deputy Governor. Karibu.
Bwana CS, people of Nakuru, want to appreciate the leadership of Her Excellency the Governor, Madam Susan Kihika, and His Excellency Bwana Davis, the DG. And we are here to confirm and to witness the flagging off of want to appreciate that the county has been able to maintain the loop and the consistency of procurement of pharmaceuticals all the way from quarter 1, quarter 2, and now we did quarter 3, and now we are doing quarter 4, what we are to flag off today. And I also want to confirm that the county has also been consistent in payments, and that is setting off the obligations that they have so that they can get the refills. Just also want to confirm that KEMSA, we are committed to do our supplies to the last mile, to the 40 health centers, 153 dispensaries, and 15 level 4 hospitals. And this is to the last mile, meaning before the week ends, or before maybe the next week, every other hospital or every other dispensary will have received the commodities right on their doorstep. In terms of affordability and quality, KEMSA, we are committed to make sure that we are giving the correct, affordable, and the right quality to the people of Kenya. Thank you so much, and we also want to appreciate the leadership. Thank you so much.
I want to take this opportunity to thank the Department of Health, led by the CC, who is not with us today. We have the Chief Officer and the staff for that work that has gone on into that activity. And I want to take this opportunity to welcome His Excellency the Deputy Governor to address us and officially commission the distribution of drugs. Thank you.
Thank you. Okay, our CS, our brother from KEMSA, our CEO, members of the 4th Estate, members of Nakuru County, good morning. Good morning once more. Now this is another day which is also very important in the calendar of our county, when today we are going to flag up some of the drugs to our hospitals. And I want to thank what she's doing, because today we are going to flag off the 4th quarter, which is going to go up to the 1st quarter for the 1st quarter. So we are not lagging behind. So in any case, when we hear people talking about we don't have medicine in our dispensaries, I want you, the members of the 4th Estate, again, even you today, I would also like you to see what we are going to flag off, and it is going to go to every hospital or every dispensary in our county. Now we have been getting some complaints about some people that we don't have some drugs in some of the hospitals, such as level 2, level 3, or level 4. I think we should be in a position to educate them that there are some drugs which cannot be supplied to level 2. For example, the cancer patient cannot be treated in level 2, and then also in level 3. So we keep drugs according to where we get the patient is going to be treated. So there are some drugs we need to explain to the public that whenever they go, somebody who is a cancer patient can go to level 2 or level 3 and start complaining that I was not treated, I didn't get the medicine. So medicine or the drugs are given according to the levels of the hospitals in our country. So I hope the members of the 4th Estate can be able to assist us also when it comes to telling the public of the supply of the drugs. So I don't want to waste time, but I want to read the speech of Her Excellency, because she was supposed to be flagging up these drugs today, but equally I have her speech, something which she would have said here today. Now, the speech for Her Excellency Susan Kihika, Nakuru County Governor, during the flagging off of drugs to public hospitals. Now, today, we are gathered here in a further demonstration of our determination and commitment to serve the people of Nakuru County through delivery of quality, affordable, timely health care in our public hospitals. Through the Department of Health, the county government of Nakuru has purchased drugs worth 26,169,126 Kenya shillings from the Kenya Medical Supplies Agency for the fourth quarter, that is 2023-2024 financial year, for disbursement to our county public hospitals to ensure non-interrupted supply of medicines. Additional drugs orders from MEDS, Mission for Essential Drugs, worth 23,541,666 Kenya shillings, will be delivered within the next 2 weeks, making a total sum of 49,710,792 Kenya shillings. The Department of Health is also in the process of procuring non-pharmaceuticals worth 47,133,850 Kenya shillings. This will ensure continuous availability of drugs and non-pharmaceuticals in our dispensaries, health centers, and hospitals for July, August, and part of September. The crossing over from one financial year to the next normally comes with a lot of delays in the disbursement of funds. In the past, these delays have affected service delivery in the first quarter of every year due to lack of funds to procure essential drugs. The consignment we are flagging off today is meant for all 208 level 2 dispensaries and level 3 health centers and low volume level 4 hospitals across the county. To ensure that the drugs reach the targeted hospitals, we have agreed with the KEMSA team that the deliveries are to the last mile to doorstep of each hospital facility. As in the norm, 75% of the drugs will be delivered to each hospital, while the remaining 25% will constitute a county buffer stock, whose role is to cushion the health facilities from any supply chain shocks that may arise before the next order is processed and delivered. Due to the delays in the NHIF and Linda Mama reimbursements to our health facilities, the revenue flow of most of them has been greatly affected. This means that the buffer stock now supports even our level, which has experienced the greatest negative effect of the delays. Indeed, one of my main pledges to the residents of Nakuru was to improve healthcare services and, more importantly, to end the shortage of drugs and medical essentials in our public health facilities. This occasion signifies our determination to ensure our public hospitals are fully with medicines during these festive seasons. In conclusion, I want to assure the residents of Nakuru County that we are working with the partners to facilitate delivery of better services within our public health facilities. In addition to ending the shortage of drugs and non-pharmaceuticals in hospitals, we are also modernizing our health facilities through acquisition of technologies to deliver services in a better way. I instruct the Department of Health to expedite the digitization of the drug and non-pharmaceuticals delivery and monitoring system to avoid theft of drugs in all public hospitals. We have a duty to account for all drugs that have been dispersed to hospitals and ensure they reach their targets. I now flag off the drugs to hospitals. Thank you, Her Excellency Susan Kihika, EGH, Governor Nakuru County. Asanteni sana.